Welcome to the Edelheit Experience, a compelling conversation about revolutionizing health and well-being, bringing you rich stories and lessons learned from leading corporate executives. Now, we'd like to introduce your host, Jonathan Edelheit.
Welcome to the Edelheit Experience. Today, I've got Heather Saunders with me, and we're going to be talking a little bit about the pandemic. Heather, thanks for joining us.
Hey, John, it's good to be here. Thanks for having me.
Heather, share with us a little bit about your experience and what you do.
Sure. Well, by background, I am a nurse. Spent about 10 years in the emergency department before switching over to working with infectious diseases as an infection preventionist. And I think before the pandemic, that was a profession that not very many people were familiar with. But now I think it's a common household profession. Everybody knows what an infection preventionist is. We prevent infections, or we try to prevent and control infections. Epidemiologist is another great terminology for that. I have worked at Johns Hopkins Hospital as an infection control epidemiologist, as well as worked for the state health department in prevention and control of infectious diseases. And I now have a private business working in preventing and controlling infections for businesses and the healthcare industry, as well as continuing with Hopkins in research for infection prevention and control.
Does this mean you're the most popular person at a bar or a party?
Definitely not the most popular person at the bar or the party. Probably the person that is telling everybody that they need to make sure that they are socially distanced so that they can prevent infection. And then they give you this look like, what? Really? I'm the killjoy at the party.
I'd say the Buzzkill. So,
yeah, there you go.
So obviously you must have had an extremely busy and crazy last 2 years.
Oh my goodness. I think for those of us that work in this profession, and huge shout out to all the infection preventionists, all the infectious disease professionals, public health, healthcare in general, my gosh, it has just been a whirlwind of 2 years. And it feels like at the end of every year, it's Groundhog Day again. And we're going, oh my gosh, we're here again, another variant, or more cases, another surge. And it just seems like, when is it ever going to end? And it has been an incredibly busy time of living and breathing nothing but preventing and controlling this infection, this infectious disease, COVID-19, this pandemic that we all find ourselves in.
It's like a roller coaster where you don't know when you're going down, when you're going up, and sometimes you're going up and then you get punched in the face and you're going down, right?
Yeah, the person in front of you vomits and then it gets all over you. Exactly.
So where are we in the current state of the pandemic? And I think we know, the next couple of weeks is going to be a mess, but what are the next couple of weeks, next couple of months going to hold for us?
Yeah, we are seeing astronomical case numbers right now. It is just astounding. And unless you've been living under a rock, you know that COVID-19 is increasing in case numbers around the world. And what we are seeing here is really this post-holiday surge. And we saw this last year. We saw this in 2020, but then we threw a new variant in the mix this year. And we can talk about that a little bit more some too. But currently there is high numbers of COVID-19 cases daily that are being recorded in various jurisdictions. We are seeing record numbers of hospitalizations. And of course, with all of that, we are seeing increases in deaths as well. So very concerning for healthcare right now. Healthcare is really getting the brunt of this current surge as people are flooding the hospitals wanting tests. Some being severe or critically ill, some being mildly ill, but still requiring hospitalization. And then our healthcare workers are getting sick too. Some of our healthcare workers are getting sick, and that is causing some staffing shortages. And of course, we're seeing this in businesses too. Businesses are also having some severe staffing shortages due to the current surge. This current wave of infections is just unprecedented. We have not seen this before in the pandemic. We are definitely hitting some record number of daily cases around the world, particularly in certain regions, but definitely seeing quite a surge right now.
With Omicron being so contagious, right? Like, we have 2 of our employees who are out sick with COVID right now. how how is it really affecting businesses? And is this going to be more disruptive than previous waves we had? And what I mean by disruptive, I mean disruptive to businesses.
Yeah, no, that's a good question. And I think we are seeing that. We are seeing more disruption. And let me kind of take a step back and explain this. And you said it, with it being more infectious, more contagious. And I think we do really have enough data, although it's still preliminary. We're still looking into this more. But Omicron does seem to be more infectious. Now, what does that mean? Well, that means that for every person that has COVID-19 with the Omicron variant, they are infecting more people than previous variants, and more quickly is what we're kind of starting to see. So we have kind of a spectrum of how many people one person with an infection can infect, and Omicron appears to be the variant that has the upper hand at infectivity. It's able to infect more people and more quickly. So previously, we were seeing maybe 5 to 7 days someone developing symptoms after being exposed. Now with Omicron, we're seeing an average, what we call incubation period of 3 days. So after 3 days, we're seeing people develop symptoms. So spreading to more people, spreading more quickly. Now, when you have a virus, an infection that does this, it is likely to be more disruptive, because it's hitting everybody all at once. All at once, we are seeing higher numbers of COVID-19 cases, which just means more people that are needing to isolate, and means more of a reduced workforce. So I definitely think this is being more disruptive. And we're seeing that. It doesn't take much reading of the headlines to see various businesses that are being impacted by the current surge. The airline industry is a big one. We've been seeing a lot of cancellation of flights. And that is not just due to the concerns around the current surge, but airlines are seeing staffing shortages. They're having trouble manning their flights. And so we're definitely seeing, I think, the disruptions from this current surge to businesses.
So how do companies balance the need, to keep their business going? How do we maintain the economy and employment and but at the same time, keep everyone safe?
Yeah, no, that's a really good question. It's a $1 million question right now, and we're seeing various ways in which we're trying to figure out that balance. And in healthcare, for example, we are discontinuing elective procedures, things that can wait. We're holding off on those things that can wait so that we can divert the energy and the efforts to the things that are critical, that must happen to continue and maintain operations. And that may mean taking staffing from some of those elective procedure areas and shifting them to other areas to work in the more critical, operationally critical areas of the hospital. That works for other areas of business as well, not just the healthcare industry, where certain things are going to have to pause so we can divert the energy to the areas that are critical for the operation of business. I think another really, really important way that businesses can ensure that they are continuing their operations, continuing their vibrant business in the economy, is by leaning into prevention. How can we as a business best prevent and control COVID-19? What can we do? What can we do to keep our employees safe, to keep our customers safe? Because that's how we're going to continue to move forward. If everybody is on board with prevention and control measures and can avoid infection, then we won't have to worry about the staffing shortages. And that is still possible with Omicron. It is still possible for us to be able to do that.
So does that mean that companies need to take a little bit more seriously now than they have had before of what they're doing to keep employees safe?
Yeah, I would say yes. And not that companies haven't been serious before. I think we have been, but I do think we got a little bit relaxed, and rightly so. Things were getting a little bit better. We were able to take a step back from some of our mitigation measures. Vaccination helped a ton and we were able to kind of relax some. Definitely now not the time to relax. We want to make sure that those mitigation measures are in place. And not just for unvaccinated folks, but also for vaccinated folks. We're seeing that Omicron and some of the other variants, the vaccinations, they work wonderfully in preventing severe critical illness. They work at preventing an individual that's been vaccinated from being hospitalized, from death against severe critical illness. They do not, however, always work at keeping that individual from being infected. And individuals we're seeing that are vaccinated tend to have much milder illness or be asymptomatic, but they still can potentially be infected and still potentially pass it on to another individual. So we got to kind of shift our thinking about what does vaccination do for us? It keeps us out of the hospital. It keeps us from being severe or critically ill. But if I, which I am vaccinated, I'm still going to wear a mask in this current surge to prevent myself from being infected, to prevent myself from passing on infection to someone else. And those are the kinds of things that companies need to be thinking about. What policies, procedures, protocols can we have in place to keep all of our employees safe and to prevent the spread of COVID-19 within our business? Because that's what's going to keep our economy going. That's what's going to keep our businesses thriving, and keep them staffed, because we'll have less employees out of work.
I think that's important, right? The less disruption, the more successful that will be. Now,
Yes.
I know that you were a part of the development of a program called Global Healthcare Accreditation for Business, which is a new accreditation which really validates an organization's prioritization or commitment for employee and customer health, safety, and well-being. Can you tell us a little bit about that program and why it's important?
Yeah, sure. I would love to. This GHA for Business accreditation, I think it's so important because it is showing our employees and our customers that we prioritize and we care about your health and safety. And we are going to do things that ensure that we are doing our best to prioritize your health and safety. And I think that is so important. When we first saw COVID-19 hit, when this pandemic emerged in early 2020, we saw employees quit jobs, walk away from jobs, because they were concerned for their health and safety. And they were concerned that their business, their employer, was not prioritizing their health and safety. And so this accreditation says to our employees, we care about your health, we care about your safety, and we're going to do things to ensure it. I think that speaks volumes. And it's so important for the business themselves too, because again, we want to be able to continue operations. And we're going to continue operations by prioritizing health and safety of employees and customers, because that ensures that we are in an environment that is not going to inadvertently spread this virus or other infections within our company. And so, that helps us with the continuity of business as well. So, it's both sides that we're supporting here. We're supporting the continuity of business, and we're also supporting the health and safety of employees, giving them that assurance that the company that they work for, the business that they work for, is going to put them first, their health and safety first. And I think that just speaks volumes. That's important today, and it's going to be important in the future too, with future infectious diseases, safety in general. So definitely an important tool that we have.
Is from a company perspective, in the elements surrounding safety that you had helped develop, how does that, what do those elements really mean for organizations, and how does it either help them look at what they're doing or look at how they're doing what they need to be doing to improve or to keep people safer?
Yeah, the elements that you're speaking about, what we're doing is we're really breaking down into different categories what companies need to be looking at when they are determining how they're going to go about prioritizing health and safety. And this really transcends this current pandemic. This isn't just all about COVID-19. It's, like you said, safety in general as well, looking at and prioritizing safety in a company. And that's something that I feel we have not in previous decades done a great job at. But now we're taking a really close look at that. How do we prioritize that? And that really means that we need to break it down further into different elements. We need to look at our benefits. We need to look at wellness and well-being separate from health and safety. We need to look at our commitments and our outward statement to our company, to our employees, our customers. And so it's really just looking step by step at how we can go about creating a safer and a healthier environment, and making it clear to our consumers, to our employees, that we are committed to that.
I think it'll be very important, especially with, since I feel like just like the housing market is a seller's market, I feel like it's an employee market now, right? Where they can go work for whoever they want to. And I just think that, employees have a choice now. And if they're going to return to work or go work for someone else, they're going to be looking for what's the best place to go work? What's the safest place to go work? Who really cares about them?
Yeah, no, absolutely. I think you hit on a really good point there. It is an employee's world right now, and it's all about retention too. If we want to retain good employees, we need to show them that we care about them. We care about them. We care about their well-being, their health, and their safety.
Now, with Omicron, we know that COVID will probably be here forever, right? Is this, are we coming towards the end of the pandemic with Omicron and how contagious it is? I know I know there's no clear answers, but if we could make, predictions of where we're headed, what would that be?
Yeah, let me get my magic ball out here.
Crystal ball?
My crystal ball, and let me look into it. No, I mean, it's gosh, I hope so. I really, really hope that we are nearing the end of this pandemic. And there are a lot of signs that do point toward that being a possibility. So when we talk about pandemics, this pandemic will end. It will end. And when it does end, as you said, likely we're going to see this being a fifth circulating coronavirus. We actually have 4 previous coronaviruses, human coronaviruses, that circulate. They're a lot of times we call them the common cold or the cold virus, but these coronaviruses, they circulate at relatively low levels. They ebb and flow throughout the year. Winter months, a lot of times we see more infections, and this, COVID-19 will likely become another circulating coronavirus. And what that means is that we have to get to a point where it is circulating throughout the year at a relatively low and stable level, and not creating the kind of disruptions that we're seeing right now. And with this current variant, with Omicron, if it is mild to a degree where we start to see less transmissibility throughout the year, more stable numbers, it might get us to the point where it becomes endemic to the population, and it loses its status of being a pandemic because it's just another circulating virus that circulates at a relatively low level. We're obviously not there yet. And the concern is also that we're going to see more variants in the future, and more variants that could potentially have more mutations. And those mutations could increase the infectivity. It could increase the severity. We just don't know yet. Again, I wish I had that crystal ball. I just don't. But there are some signs that Omicron might be getting to the end, and that we're going to see some reduced numbers after this current surge, and it'll settle and level out. But I think time will just have to tell. And until then, we need to continue to prepare, continue to encourage vaccination, because that will help as a society to not produce any further variants. Collectively, we want to work toward that, and continue to do what we can to keep ourselves, each other, safe and healthy, and that includes in our businesses, making sure that we are doing our part to do that for our employees and customers.
Now, if this shifts over to being an endemic and not a pandemic, if we look, everyone's kind of wished this away the entire time, right? It's like this is going to be a couple weeks, then a couple months, and then this is it. And is are employers going to be able to like go ahead and say, we kind of hit the touchdown, the Super Bowl's over, and like I don't need to worry about infectious diseases anymore, or is this the wake up call to say you've basically had tremendous disruption to your business the last couple of years. There are going to be more infectious diseases, and you need to have, the best policies in place so that your business really thrives and doesn't constantly have setbacks.
Yeah, definitely the latter. This should be our wake up call. For a lot of businesses, they were not prepared for a pandemic. They just weren't prepared for a pandemic. They may have had a pandemic policy and they had to dust it off of the shelf and look at it for the first time. This is our wake up call for us to be able to say, this caused huge disruptions, like you said. We lost employees, we lost either to leaving the businesses or lost employees to death in some situations. We need to take this as our wake up call to say that we need to be ready for the next pandemic, because unfortunately there will be a next pandemic. And every year we have infectious diseases that circulate within our businesses that we have the power to prevent and to control. And that will help us in the continuity of business, and also just to keep our employees and our customers safe. And I think that's the bottom line is safety, health, and safety. It should have always been a priority. And we're now waking up to see that it may not have been. And we have the opportunity to change that. We can now move forward and maintain it as a priority. So as I mentioned before, GHA for business, that accreditation, that transcends the pandemic, because we have woken up to the importance of valuing and prioritizing the health and safety of our employees and customers.
And at the end of the day, I think what this pandemic has shown is we're a global world, and there's so much business travel, personal travel, that you can't stop anything, right? It's when this happened, it's everybody was like, oh, that's in Spain, that's in Italy, that's not us. But whether it's a new variant or another infectious disease, there's no way to keep it out. So you need to be prepared. You need to have policies. What do you say to companies? One thing that you said to me was like, companies, if they didn't have it, needed to create their pandemic policy. But what do you say to the companies that don't have a pandemic policy, even till today?
Oh, yeah. I mean, start writing. Start writing. But also use your resources. There are now so many different resources out there, and various companies that are helping businesses to write those policies, to look at those policies and make sure that they have what they should have in them. So they don't have to go at it alone. Before the pandemic, they might have been alone in their office writing this policy, looking through books to try to figure out what am I supposed to do here. But now there's so many resources out there, and they can utilize those resources to help them write those policies. And make that easier, and integrating different protocols and procedures into their businesses.
One last question I have for you, and this may be a loaded question, maybe not.
Oh boy.
where do people go just to get accurate info? Because we know this is so hyped. There's so much politics. There's so much emotion into it. I feel like, I really had believed this was going to bring our country together, but it ended up polarizing us some more. Where, like, is the CDC the best place to get the guidance? I know also you have, your own consulting company. Like, where should companies turn to not get caught up in, like fear or other things, and just figure out what they need to do?
Yeah, one of the things that really saddens me the most is how much the public seems to have lost faith in public health, when that should not be the case. Because number one resource and thing that I turn to in trying to establish truth is public health. Public health has always been there to protect the health and the safety of the population. And as a previous public health worker, I personally know these folks, with CDC and with the state health departments, and their commitment to truth and health and safety of the population, and ending this pandemic. So my number one trustworthy source is public health, whether that is your local health department or your state health department, CDC. You live outside of the United States, it might be a different public health agency or World Health Organization. That is our number one source of truth. I personally also look into reputable peer-reviewed literature and research articles, and to my own colleagues that are doing research. I know not all of us have the inside scoop and the colleague that they can call up on the phone, but definitely, public health, healthcare in general. So your local hospital, a lot of local hospitals are posting information, and they are, local hospitals, CDC, they post information on social media as well. That's the one time that I will say social media would be an okay source if it is coming from one of those reputable sources. But I think what has been really clear to me is that during this pandemic, we've seen the threat that social media poses to the efforts of public health, and the misinformation that it spreads. And so being really careful about what your neighbor is posting, or what your business down the street is posting on social media about their experiences with the pandemic. They may or may not be true, but we definitely want to go to the source, which the source would be public health, healthcare. Those are the sources that we really need to look toward whenever we're trying to determine what we should or shouldn't do.
And my last question for you is, for a lot of us, we've lived in lockdown the last 2 years, and probably we're all dreaming of vacations, when is it safe to go on a vacation? And also, what would be your dream spot to go on a vacation, Heather?
Yeah, my dream spot to go on a vacation. Oh, I love the beach. I just love the beach. Yep, that would be my dream. My dream spot is somewhere on a nice warm beach. And especially right now, because a lot of parts of Maryland and in various regions of the United States, at least right now, is getting hit with snow. So I dream of the beach and warm weather right now. When is a good time? When is a safe time? I think that it depends on multiple different factors. Again, everybody's has a different risk tolerance, and that's what we're talking about here. When you're talking about, can I go on vacation? It's, what is your risk tolerance? And that depends on a lot of different factors. So one of which would be your vulnerability to the virus. And vulnerability, that could include, are you vaccinated? Have you been vaccinated? Do you have medical conditions that put you at a higher risk of severe infection? Or do you live with someone that is at a higher risk of severe infection? And then, after determining your risk, what is my risk? What is my risk tolerance? Then it's determining, what kind of vacation am I going to go on? If I'm going to go to the beach and I'm going to be alone by myself, that accomplishes social distancing. How am I going to travel there? So there's various ways in which we can still have recreation, we can still travel, and we can still have vacation and still be safe. And it's just a matter of looking at risk and looking at what are those measures that we can take to keep ourselves safe, such as masks, social distancing, not going to the rave on the Friday night, various things like that. So that is a loaded question. And it really is very dependent on the individual and the individual situation and the state of the pandemic in the region in which they're wanting to visit.
Well, you're welcome down here in Palm Beach, Florida, anytime. But I have to warn,
thank you.
I have to warn you, we have a cold front right now, and it's like 65 to 70 degrees, so it may not be too warm for you.
Okay, well, I can't necessarily take a swim in the ocean, but maybe still sit on the beach.
Yes. The advantage of the winters here, though, is you get to swim with the manatees if you want to, if you're an animal lover.
Oh, I am. That sounds amazing. Oh, you're giving me beach fever.
Well, thank you so much for joining us, Heather. I really appreciate your insights and a view of what's to come and how prepared we should be and what we should be doing.
Thank you so much. It was nice to be here. Thanks.